Hi, I'm certified nurse midwife Sharon Greiner, and you are watching Ask the Expert. January is Cervical Screening Awareness Month. In this month's episode, I'm going to discuss the importance of routine screenings and the way you can prevent cervical cancer. A cervical cancer screening is a preventative exam that we test for abnormal cells and also for human papillomavirus, which can be one of the leading causes of cervical cancer. How often should a woman screen for cervical cancer, and what age are we starting currently? That is currently recommended to start at age 21, and obviously it will change based on what your results are, but as long as everything's normal, as long as you're 21 to 30, it's roughly every 3 years. What should you expect during your first screening? That will be a complete health history by the provider, who's going to ask you questions regarding your health and possibly your family's health. We will then complete a pelvic exam. We will take a look at everything, make sure everything looks normal, and then we will collect the sample from your cervix. It is so important for women to get cervical cancer screenings because the earlier that we're able to detect cell abnormalities or any kind of changes, the earlier we can prevent it from transitioning to cervical cancer, or we can start treatment early. The HPV vaccine helps prevent cervical cancer by allowing your body to be introduced to virus-like particles, which in turn actually helps you create antibodies to fight future viruses that you may come in contact with. At what age should somebody receive the HPV vaccine? Well, ultimately, you can receive it as early as 9 years old, all the way up to 14, which would include 2 doses. The reason we start so early is because we actually would like to get the vaccine in before somebody is exposed to the actual virus. You can get them also 15 to age 45. And if you've already been exposed to one in the past, it's completely okay to get that HPV vaccine because the virus that you come in contact with later in age might be one of those high-risk HPV viruses. So we actually do not test everybody for HPV. We go by the recommendations, by CDC recommendations and by ACOG recommendations. And normally, what will happen is if you're young and healthy, you may come in contact with the HPV virus and your body is able to be strong enough to fight off that virus. As we get older, start having comorbidities and our immune system starts decreasing, we want to make sure more often that the patient does not have HPV because they in turn could lead to cervical cancer. If someone's due for their cervical cancer screening, North Shore can help by scheduling you an appointment. We're not a huge wait. We also are FQHC, federally qualified, and we do take everybody regardless of insurance or not. Are you due for a cervical cancer screening? Schedule an appointment with a women's health provider at a North Shore location near you by visiting northshorehealth.org.